All right. So we are doing this late, and that's okay. But I'm excited because we get to talk about something that is extremely important. So last week, Susanna, why don't you tell actually? Who did you meet? What did you do? Rather than me say, actually, changing my
Sure.
mind.
So last week I had uh, a nurse, a cardiac nurse, assist me in my journey to learn more about cholesterol, to learn more about diabetes, to learn more about the body, to learn more about everything. Um, and every day I had a challenge to explore and to, to take tests as well as to um, to basically find out what I'm learning and how to connect it to my life. And then on top of that too, I was also eating. Well, I had a Mediterranean diet, uh, cooking foods. I was supposed to focus on one item, and
Hmm.
that was last week.
Hmm. Awesome. So to give some context into how we did this, Susanna had a one-on-one conversation with the nurse. I think I was there actually. Was I there? Yes, I
Yes,
was.
you were. Oh yeah,
So
for sure.
not one-on-one. And it was essentially to get to know what Susanna's dealing with, what she wants to know more about, what she's interested in. And through
Mm-hmm.
that, Sasha put together a wonderful presentation for Susanna that addressed exactly the things that she was interested in. And these quizzes, these tests, these quests, however you want to call them, they were designed for her specifically to learn about the things that she wanted to learn. We're not telling her what to learn. We actually wanted to know where she struggles, what she wants to learn more about. And that's what directed all of the quests. And that's why I call them quests, because they are driven by you. Oh, you, right? A test kind of occurs like a chore. Your quest is your journey. And all of what was created for you by Sasha was for you. So, well, I mean, it's general information, I should say, because it's not a diagnosis. It was general information based on topics that you wanted to learn. I need to be responsible for that. So,
So I guess I've been avoiding having to not live life
mhm,
and not being mindful about it and just having like, okay, it's living life in a way that it's not, I guess, genuine. There's feeling disempowered and whatnot, and feeling that it's not like it doesn't like like my goal for diabetes is like a chore. Oh, I have to get out of it. Oh,
mhm,
that it's just because it impacts my family. And what
mhm,
I'm learning right now is that it is a choice, but at the same time, this is life or death here. Like I gotta take this seriously. Like I've got to like in order to get out of diabetes, I have to put in the actions, and not just the words, but also the actions, and uh, to be showing up with intention more and more every day, and having the fact that I'm worth it, accepting the fact that I like it's not, like I'm not just some instrument for myself to do stuff. Like I'm acknowledging that it takes a bigger realization that I am worth it, and I want to do this because I want to be alive. So that I'm
mm,
experiencing the drive that allows me to be here is
mm,
that I want to be here. Like I see that I have a lot of the characteristics that will assist me. And I want to say thank you to those people who filled out those surveys, and it's helped so much that I was, for the longest time, thinking that I wasn't a good friend, that I wasn't interacting, like I was a burden to others. And now I see that there's so much more than like I see that people see it, and I'm being heard, and I'm being like acknowledged. And I thought I wasn't, and I was under this whole math that things weren't going as I wanted it to be. And I have it right here, you know, in my life is like all these wonderful things that were said, you know, with regarding to you know, the surveys have that I my efforts that I'm putting out there are being heard, and I wasn't listening hard enough. I feel like I yeah, I'm just changing my route right now of how I'm going to be tackling my health in my life, and I'm realizing that I'm becoming more alive and more, you know, just willing to live more than, you know, just having it like being a chore.
Mm-hmm.
If that makes sense.
So what action can we celebrate that you did yesterday?
Oh yes, that's right. That I'm taking more responsibility of my health, and so I called up my doctor,
Mm-hmm.
and I said to my doctor that I want to take care of my health, and I would like you to reissue me all those requisitions so that I can get my health in order.
And
And
how long have you been putting that off?
amazing. For a long time. Like
How long?
it's like avoiding getting those tests done. Like
Mm-hmm.
like was diagnosed with diabetes for like almost, I would say it's about close to 5 years, and
Mm-hmm.
I haven't been taking it seriously. I haven't been taking my metformin. I
Mm-hmm.
haven't been, you know, just taking care of my health because I'm thinking like, oh yeah, I can figure it out eventually, you know, but
Mm-hmm.
not really taking it seriously. Called him up. I called her up and I said, you know, I want these tests done. I'm going to get my health in order.
Mm-hmm. And you deserve to be acknowledged for that, because that takes a lot of courage to be able to put aside your fears and do it anyway,
Yes.
knowing that you're worth it. And so for the people who are listening right now, what are you declaring?
I am declaring that I am going to be alive for myself, and also, you know, this is like if I could word it in such a way about like, imagine if you have a shovel and it's broken. Like, what type of shovel would this be if it wasn't, you know, so that I relate that with myself. If I'm broken and I'm not able to help others, then I'm being ineffective. So I need to take care of myself. So in order to use that shovel, it needs to be strong and sturdy,
Mm-hmm.
and also do its functionality, right?
Mm-hmm.
So I want to be, you know, that as well. So I want to build myself from inside and, you know, get my health in order so that I can help out.
Yeah. And so helping people is something that means a lot to you. And what you've realized is that if you haven't taken care of yourself, then you almost put this like limitation on how much you can then be there for others. And if your focus is so much on being there for others and leaving yourself behind continually, the way that you're expressing it is like a shovel. That if you're a broken shovel trying to assist others, that doesn't work. I mean,
exactly.
You're not just a tool or a shovel. I love your analogy. And what you're really saying is that you matter, is what I'm hearing.
Yes. I need to and I'm taking that responsibility right now to get my life in order.
If you make yourself a priority, it will happen.
Yeah. And that's what I haven't been doing for a lot of the times, is making myself or my health a priority. And I'm taking that action. Yeah. And that's a different step right now.
Hey, it all takes like discovering, right? Because the thing is, everybody has their own pathway to get there.
Yes.
But you have to treat it like you matter. Not like it's something that you do sometimes on the weekend when you feel like it, right?
Yeah.
Or your results will be consistent with being someone who just takes action when they feel like it.
And that's not intentional. And I think
Nope.
that's something that's like, you know, definitely we need more of the intention in our lives, right? So,
Hmm.
yeah. Mm-hmm.
So now what I thought we could do is I thought that we could share Sasha's document that she created, and
Sure.
we can go to the different areas that you'd like to share that impacted you during this whole week. Like, I want you to tell me where you'd like me to go on the document, and I want you to share. I don't know why I'm saying the same thing over and over for the second time. You get what I'm trying to say.
Yes. Okay.
Catch myself sometimes. Sometimes I say the same thing twice and it doesn't even need to be said. So let's do it.
Okay.
So, like I was saying, when this was created, these are general pieces of advice at the request of wanting to learn, Susanna wanting to learn more of, and it should be taken just as general information and education, and not as
Mm-hmm.
medical advice. And getting to your healthcare practitioner or healthcare provider is always needed. So, where would you like me to show everyone? What impacted you?
We can go to the different fatty deposits.
Okay,
There
here
was
we go.
that one there. Yeah.
What impacted you here?
Well, I didn't know about how the heart and the blood flow, how it's all connected, and the way that I relate it, it's very similar to like you have milkshake, right? So
Mm-hmm.
you go to like Dairy Queen or you go
Mm-hmm.
to like a place that has milkshake, and
Mm-hmm.
you're trying to sip up the milkshake into that
Yes.
straw when it's
Yeah.
super cold. And it's
Mm.
like you can't because it's like it's restricted by something and it's
Yeah.
blocked by something.
Mm-hmm.
So I realized that, it's like that same effect when you try to sip the milkshake into your mouth using that straw,
Mm-hmm.
it doesn't go and it doesn't work. And you have to, it exerts more energy, more effort, and there leaves an impact on your body.
That's right. I love that analogy. Thank you for sharing that. That's an awesome analogy.
Yeah. So
Cool.
until
What
we
about
melt
this
that,
one?
right? So yeah.
What about this
Um,
one? This is a big one for you too, hey?
oh, huge. Like I always thought that women experience like heart attacks in the same way that men do.
Mm-hmm.
So yeah, like I mean, they always say like if your chest hurts and whatnot, then go to the emergency room or something.
Mm-hmm.
But yeah, but like for women, it's drastically different. Like if we take a look in the next screen, it happens where it's in the throat. Looks like
Mm-hmm.
it's at the throat, and then it goes to the underneath the breast, and then it affects. So when it affects you, it's affecting on the throat and underneath the breast, and then wow, so it's totally not the chest. It's just the throat. Wow, yeah, that's really really surprising.
Yeah, and like chest pain is primarily, it's described as like a pressure or tightness and squeezing and crushing rather than stabbing. And so for men, it occurs like stabbing, right? So the
Mhm.
feeling and the way that a lot of women who are having a heart attack express their distress, it's not
Mhm.
consistent with the way that we have grown up knowing heart attacks to be. So
Right.
we often don't take it seriously because it doesn't sound like a heart attack. And the impact of that is that they don't get to the hospital quick enough, you know?
Mhm.
And
Mhm.
so it's very important to know this because
Mhm.
the trouble in academia is that the population that's generally studied are white males at the college age. So in medicine, there is a lot more women's studies that are taking place because our physiology might be very similar, but there are some differences with respect to hormones and the way we experience certain things in our bodies. So
Mhm.
I'm glad that that was helpful, and Sasha was able to bring that to your attention.
Mhm.
All right, next one. Oops. There we go. This was another big one for you. Why don't you say
Yeah.
some words about this?
Well, this is what I was referring to earlier.
Hmm.
What the things that I can work on and the things that I was surprised about. Like there's the high stress, anxiety, and depression there. So basically, these are risk factors that, um, contribute to, our health and in terms of like heart disease as well. So smoking, sedentary lifestyle, poor diet, high BMI, waist circumference, high blood pressure, diabetes, high stress, um, and anxiety and depression and socioeconomic factors. Like I could relate to the sedentary lifestyle because I'm working in the call center, and poor diet because my boyfriend loves to eat out. And
Hey, no blaming.
um,
No blaming.
oh
You
yes,
choose
that's
to
right.
join him.
That's right. I did choose to join him, and
None of
I
that.
chose to eat out more. Okay. High BMI waist, I can totally relate to. Diabetes, yep, that's something there. High stress, anxiety, depression. That one I'm guilty of. It just happens, and there's nothing wrong with that. And then the socioeconomic factors, like for example, if we choose to just have live paycheck to paycheck. It's a choice, as opposed to like, taking care of our health.
Hmm.
That really helps a number of things and factors in regarding to this
For the record,
chronic disease.
for the choice of living paycheck to paycheck, just to say more about that, it's like if we avoid um like decreasing our spending, or if we avoid, you know,
Mhm.
taking action to get a raise, if we avoid responsibilities that would pay down credit, stuff like this,
Yeah.
that is what that comment kind of means.
Hmm.
Just because it can land sometimes with people, like, because that's something that is sometimes hard for people to digest. It's a
Hmm.
very involved statement. Just wanted to be
Yeah.
responsible for that.
Okay.
Hmm.
Got it.
Anything
Hmm.
else here?
Um. No. Well, non-modifiable age. No matter how old you get, I guess,
Hmm.
and
Well,
a
you can't
family
reverse the
history.
clock,
Yeah,
right?
as
You can't
well as like
modify your age.
that's right. And family history of heart disease is
Yeah,
also
can't change that.
non-modifiable. Can't change that. And ethnicity.
Can't change
And
that.
yeah. Mhm.
Yeah.
Yeah. So that's that's what I'm realizing. Like these are important. And of course, there's the risk factors for disease. For heart
For
disease are
women
unique to
uniquely.
women.
Hmm.
Yeah. Lot like pregnancy, irregular periods. Yeah,
Hmm.
regular periods, which I don't have yet. So I'm working on that with my doctor. Um,
Hmm.
hmm And then there's like heart disease treatment. I wasn't aware of the wire threaded through an artery with
Hmm.
a stent. I
Hmm.
didn't know about that, but I knew about the open heart surgery.
Hmm.
But 'cause it's important to know medications and yeah. Um, this one is something that you've been driving home to me all this time.
Hmm.
About 30 minutes or more of moderate to vigorous physical activity most days of the week, giving about greater or equal to 150 minutes weekly,
Hmm.
and maintain a healthy body weight and composition.
Hmm.
And what we talked about was eat a balanced diet, such as the Mediterranean diet. And that's why I got the task of getting involved into that, the
Hmm.
fruit, vegetables, and whole grains and olive oil, which
Hmm.
reminds me I have to buy more olive oil. um, Fish and high omega foods and moderate dairy and meat. Hmm
Hmm.
And then there we go, or diabetes.
Hmm. So this is just some information about diabetes and some of the different
Yeah.
ways that it impacts like your vessels. And so one
hmm
of the things that you found interesting about that, I think you can speak about, and it's here, microvascular are
So,
like the small vessels, and then
hmm
the macrovascular are the larger vessels that can impact your your larger vessels.
Mm-hmm. Heart disease was the biggest one, and I didn't know that. That was a big eye opener for me. That's why I was like, wow.
Connecting it with because like one of the things
Right.
that Suzanna kept on asking about to Sasha was getting her to connect what like the different topics about like fatty plaques and how it relates to diabetes, how it relates to like she kept on asking questions about that to understand deeper. I can remember when you were talking about that, and then also like one of the things that came up was like, why do people have to amputate their feet, for example, if they have diabetes, right? And it's learning that like that block of blood flow is the reason, right? That impact can get so severe that it does lead to having to amputate. Anything else for this one?
Well, I was surprised about the blindness. I didn't know that was an effect of diabetes. And
yeah, because those small blood vessels in the eyes.
Oh, that's not good. I love seeing things, so I don't want to sacrifice that.
Totally. Well, it's cool because like our like circulatory system or like our blood flow, it literally interacts with every single part of our body. So you can think about it like if you're taking care of your heart, you're taking care of your brain, your eyes, your everything. And that's why exercise is so important. That's why drinking water is so important. That's why sleep is so important. That's why nutrition is so important. And that the more you learn, the more you realize that all of them are so interrelated. That your sleep predicts your fitness, predicts your nutrition, like they're all like interlaced and connected.
Yes.
So that one, PCOS. This was the one that I think that you found impactful.
Yeah, I didn't know that like weight gain was a thing, and also like hair loss, which I'm experiencing right now. Yeah. And irregular periods. That's something. Yeah.
So it's kind of like seeing the connection between everything, right?
Yeah, exactly.
And the way that Suzanna, you're taking this, just want to say is like it's courageous, because like a lot of people when they take this information, they take it from the lens of fear, right? But you being able to like be like, wow, like this is so interesting that like these things are connected, and you can understand how your individual actions, like getting up this morning and taking action on your health, like it's so great. So the other one's metabolic syndrome. And again, this was another thing that we kind of like connected metabolic syndrome with diabetes, with heart disease, and like can see like the interrelatedness between
the body weight. Yeah, increased body weight. It is a major risk factor for metabolic syndrome, as is a high carbohydrate diet, physical inactivity, smoking, postmenopause, and family history. Yeah.
So this talked about like the different types of diets, and Mediterranean diet is a very well-known and studied diet, and making sure to get your fiber. Little bacteria in your gut, they eat those little things, and they may actually make your metabolism faster. They do a whole bunch of other things, but we're not going to get into that. And this is a big
the lifestyle modification. Yeah, for huge. So I always thought that it was like physical activity, but it's actually food that makes a big difference.
Yeah, and it's all of it together. Like if you exercise and you eat less, it's way more powerful than if you just ate less. And it's all to do with something that we have talked about extensively, which is like insulin sensitivity. Because when we move our muscles, we are utilizing the sugar within our muscles and liver, and we are improving our insulin sensitivity, which then impacts diabetes over time. We get more efficient at using insulin.
Mm-hmm.
You know.
Yeah.
So inflammation. This is the bridge. One of the things that Sasha spoke about. It's the common factor between heart disease, diabetes, PCOS, obesity, metabolic syndrome, and more.
Mm-hmm.
Metabolic dysfunction, you know, our fat cells, they play a role by activating pro-inflammatory signaling, meaning that more fat, more signaling of inflammation. And something that I'll add to this is that when we are inflamed inside,
Mm-hmm.
we don't experience pain. But if you were to take a knife and cut yourself, you would see your skin start to go a little red. It would get painful, wouldn't it?
Yeah.
Because we have pain receptors. We don't have pain receptors inside where we experience pain the same way.
Mm-hmm.
If you're experiencing inflammation from a cut, you feel pain, don't you?
Yeah.
You
Sure.
don't eat foods that are pro-inflammatory and then you're like, "Oh no, my insides are sad." You don't experience that pain.
Mm-hmm.
However, your body is signaling to you that it's in pain.
Mm-hmm.
So that's just something to chew on, pun intended.
So what you're saying is that if it's an inflammation, does that mean that it's that it's on fire, or that
I
it's
guess you can think about it that way, sure. Like like inside your body, the inside of your body screaming fire, 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 but you don't experience pain.
mm-hmm.
Instead,
I see.
it manifests as diabetes, heart disease, and other types of reactions to that fire, fire, fire.
Mm-hmm. Mm, I see. Okay.
On the physical end, like I'm using the analogy of like cutting my hand with a knife by mistake, not on purpose.
Yeah.
And then your hand like gets all red and swollen and stuff like that, and it starts bleeding, right?
Mm-hmm.
It
Yeah.
it hurt, right? It didn't feel very good,
Mm-hmm.
and you know, now it's getting all puffy.
Yeah.
When we are inflamed inside, we don't get those signals. Instead, they manifest as larger tummy, diabetes, heart disease.
Mm-hmm.
They are
Mm-hmm.
things that we can manage with drugs and whatever, but
Yeah.
it doesn't occur to us as a cry for help from our body. It occurs as just the state of how it is. And this is an overly simplified version, and it's from my lens and not like something that I would recommend taking as like, you know, there's so many layers. So that's my
Yeah.
disclaimer.